Hi guys, welcome to this channel. Today we will be learning about the composition of local anesthesia solution. So, talking about the component of local anesthesia solution, we must all have seen up to now this kind of container of local anesthesia solution. But have you ever wondered what sort of things or what are the ingredients that are added to a local anesthesia solution? So, today we will be learning about each component and why they are added, and eventually you will understand by yourself the function or the significance of each component. So, let's get started. Before going on to the individual components, let's have a basic concept or a basic understanding, rough idea about it. So, talking about the local anesthesia component, the basic and the obvious component is local anesthetic drug. But the problem with the local anesthetic drug is it shows vasodilatory effect, due to which the local anesthesia is removed from the site of injection more rapidly, due to which the depth and duration of anesthesia decreases. And so, to increase the depth and duration of local anesthesia, another component is added, that is vasoconstrictor. Now, the vasoconstrictor also has one problem, that is, it is not stable. Unlike local anesthesia, which is stable, it is not stable, and so it has the tendency to get oxidized. To prevent the oxidation of vasoconstrictor, another component is added, that is antioxidant, which is sodium metabisulfite. Now, let's move on to other component. Now, another component is sodium chloride. One thing that you need to know in this case of sodium chloride is that whenever we are giving any solution or anything to our body, it should be isotonic to the tissue of the body. It shouldn't be hypotonic or hypotonic. If it is hypotonic, then cells tend to shrink, or if it is hypotonic, then cells swell up and has the tendency to burst and also can go under the lysis. So the to make the solution of local anesthesia isotonic to the tissue of the body, sodium chloride is added. Okay. Now, another thing is distilled water. It is just added to provide volume to the solution. And lastly, methyl paraben. It is added due to its bacteriostatic property. So, let's wrap it up. Local anesthesia. Local anesthesia is a basic component. To increase the depth and duration of local anesthesia, another component is added, that is vasoconstrictor drug. And to stabilize the vasoconstrictor or to prevent its oxidation, another component is added, that is antioxidant. And now, sodium chloride, it is added to provide isotonicity to the local anesthesia solution. Distilled water, it just gives the volume to the solution, and methyl paraben, it gives the bacteriostatic effect to the solution. So now let's learn about the individual component of local anesthetic solution. So the first agent is local anesthesia drug. Its function is to block the nerve conduction, and mostly lidocaine hydrochloride is used as a local anesthesia drug. And one of the good property of local anesthesia drug is it is stable and is capable of being autoclaved and boiled without breaking down. Now, the second component is vasoconstrictor drug. As I have already said, it increases the depth, duration, and safety of local anesthetic. Mostly epinephrine is used as a vasoconstrictor drug. And now, one thing that you need to understand in this vasoconstrictor drug is the pH of dental cartridges containing vasoconstrictor is lower than those not containing the vasoconstrictor. Here you need to understand mostly the pH of plain local anesthetic is 6.5, but with the addition of vasoconstrictor, the pH drops to 3.3 to 4.5. Now, you might think that what is the problem with decrease in pH? Now, you need to understand one thing that you need to understand here is that with lower or more acidic pH or with decrease in pH, more of a burning sensation is experienced by the patient, so more of a discomfort is there while giving the injection of local anesthesia. So because of this pH difference, the plain local anesthetic have somewhat more of a rapid onset of action and is more comfortable to the patient. Now another component is antioxidant. The function of antioxidant is it prevents the oxidation of vasoconstrictor by oxygen, which might have been trapped during the manufacture or might diffuse through the semi-permeable diaphragm after the feeding. And mostly sodium bisulfite is used as an antioxidant. Now, let's understand what is the mechanism of antioxidant. Here, the sodium bisulfite react with the oxygen faster than the oxygen is able to destroy the vasoconstrictor. The antioxidant, that is sodium bisulfite, will prevent the oxidation of vasoconstrictor by reacting with the oxygen faster. Now, when this reaction takes place, the sodium bisulfite becomes sodium bisulfate, which has even more lower pH. As I have already said that with decrease in pH, the burning sensation is felt. Here also, it is the same with the clinical relevance. Increased burning sensation is experienced by patient on injection of older cartridges with vasoconstrictor as compared with the fresher cartridges. Now, the other component is sodium chloride. It makes the solution isotonic to the tissue of the body, and other is distilled water. It acts as a diluent to provide volume to the solution. Lastly, methylparaben. It possesses bacteriostatic and fungistatic properties. There is a major change in cartridge's composition by the removal of methylparaben because of the two main reasons. First is dental local anesthetic cartridges are single use items and are meant to be discarded and not reused. Mostly methylparaben and its related compounds are found in multiple dose vial of drugs like creams, lotions, ointments, and while dental local anesthetic cartridges are single use items and are meant to be discarded and not reused, so there is no relevance of adding methylparaben to local anesthetic solution. And second is reports of allergic reaction in some patient. Due to these all sort of reasons, methylparaben is now not added to the solution of local anesthesia. Lastly, thank you for watching and please do subscribe to this channel. Thank you.